Hey, my wonderful, wonderful, lovely people, a pleasant afternoon to you. Beautiful people, I am not sure if you are seeing what is happening on the news. Health facilities island-wide under emergency mode due to strike by junior doctors. I'm looking at the Gleaner online. It says the Ministry of Health and Wellness says health facilities island-wide are operating under emergency mode due to a sick out by junior doctors. Don't know why they say sick out, but maybe that's how they do it. It says workers, as in the junior doctors, took industrial action to press the government to address compensation issues. The health ministry says under the current situation, while emergency rooms remain open, outpatient services and elective surgeries have been significantly scaled down or otherwise suspended. Health centers have also been affected. So far today, there has been a reported 16% doctor turnout in primary care in the Western Regional Health Authority and 28% in the Northeast Regional Health Authority. At the same time, there are some hospitals and health centers that have reported as high as 100% no-show for their junior doctors. The health ministry says every effort is being made to mitigate the impact of the protest by the doctors on the health system. As a result, elective procedures and outpatient appointments at hospitals have been rescheduled. So to clinics at health centers. Listen to this part. Can you imagine? I'm actually reading this. To support the public during this time, the ministry advises the following. Avoid hospital visits where possible. Mighty God. For non-urgent medical advice, contact your private physician. Maintain health precautions and follow basic hygiene practices. Access emergency care responsibly. Mighty God. Am I really reading what I'm reading, my beautiful, wonderful people? I never dreamed the day that I would have seen doctors strike at some, it says at some centers. I don't, our locations in terms of hospital, healthcare facilities. 100% of the junior doctors didn't show up. 100% of the junior doctors did not show up. Yet people saying life is great, life is wonderful. Doctors, when I was much younger, to be very honest with you, that's the most expensive degree I think you can do. It's the most costly of all the different degrees. Medical, between law or actuary or whatever, something, becoming an actuary, an actuarial science, sorry. I know that those are also expensive, but not as expensive as studying medicine. Very, very costly, the most costly of all of them. And I was told, back in the day that, that's a creme de la creme position sought after when you're when you study to become a medical doctor. It is as though you've reached the pinnacle of a career. Medicine first, medical doctor, because it deals with life and health, and law and some of the other subjects and courses. But medicine, that is the ultimate. That is just, it's like you're in heaven. It's like a utopia you would have reached. And in this 21st century, in 2024, the closing almost of 2024, our junior doctors, they are on strike. They have taken industrial action because of poor salaries. That's what it's really saying. And the public is now advised, if you're not to go to the doctor, don't go. Can you imagine? Can you imagine? A life or death situation. Because what it deals with health, it deals with your life. It deals with your life. No matter if it's a little ailment, a little pain in the knee, a headache or whatever, it still deals with your life. And they're advising, if you don't need to go, don't go to the hospitals. If you don't need, can you imagine? I can hardly believe what I just read It has not gone into my muscle memory because when vloggers like myself and come out and we speak, you hear people coming to rebut everything. When we say people are poorly paid in this country, poorly paid. I have a family member who is a medical doctor, and he says, you know, up to now his contract, fantastic fellow. And it's not because it's a family member, you know, it's not one that I'm close with, you know, it's not one that I would say I'm close with. And they said that a number of them are still on contracts, they're not on staff. And the salaries, you just have to laugh when you, and that somebody had shown me the salary scale for some of these doctors. I said, what? Under the 500,000 that a minister years ago of this present government said, anyone earning, you know, 500,000, they didn't even say under, because it would be a travesty of justice to say under. It goes without saying that anyone earning $500,000 per month, because he had quoted the yearly figure at the time, it was 6-7 million. At the time, at that year, it worked out to about $500,000. They were barely scraping, because this was long before COVID. This was long before we thought of COVID. Long before we thought of COVID. Said it, and I was shocked the evening I heard it. I was like, the next day I remember going to my colleague and said, you heard what so-and-so said? And she said, she frightened out our wits. That means most people are decomposed, dead, possibly can never be resurrected. I talk about the civil servants, you know, they had made, you know, from January, we are now in December, and they've been asking for retroactive mileage or passenger mileage, retroactive pay, uniform allowance, all sorts of things that requires money and to staff. We are now in December, and I doubt that this Christmas the civil servants are going to get the monies, unless a miracle from God, unless God says, no, I'm going to, you know, turn over some things. I'm going to ensure that people smile, if it is even 1 week out of the year. And it happens to be Christmas. It happens to be the month that they celebrate the birth of Christ. Though he was not born on Christmas Day. You know, people choose to use it as a celebratory day. You know, the time is cool, the time is lovely, the time is wonderful. And if he had not come, many of us would not understand what it means to have life and have it more abundantly. So just as how his death, burial, and resurrection, you know, they were significant, his birth, certainly, because if he didn't come, we would still be in the problem. So all of them, the birth, the death, the burial, and the resurrection. And when we talk about these things, people are saying, you know, oh, the country is beautiful. You can't use your pocket to judge the masses. We see the infrastructure, there are a lot of buildings going up, you know. It is like somebody, when they get their salary, they use it and buy only clothes and shoes. And they expend it all on that. And they you know, spend all the money on that. They're going to starve. They're going to be hungry because they're going to need food to eat. They didn't create a balance. They didn't create a balance. Stewardship is about balance. It's about increase, but it's about everybody benefiting in the right way, on equity, on merit. You have people who have first degrees, masters, and even PhD, and they're earning under $500,000. How can you be having a master's or a PhD and earning under $500,000? When just to do both of them costs way more than that. $500,000 per month, I'm talking Jamaican dollars. You don't even want to calculate that back into US, because it's a joke. For people who with less qualification, and it's not just the qualifications, you know, people. We're talking about competencies, skills, ability, agility, vim, vigor, vitality, competent, contributing to growth and the development of the companies and the society at large, their families, and still can't get $500,000 per month after tax. May God help us. I don't know what to say. Read the striking of the doctors. To be honest with you, beautiful people, I don't know what to say. May God help us. That's all. Guys, you know what to do. Read TikTok and YouTube. Subscribe. Please, they beg you one of them lion there. Please, thanks.